Good afternoon, everyone, and welcome to our presentation today, Alzheimer's disease, signs, symptoms, and steps to reduce your risk. My name is Jennifer Reeder. I'm a licensed clinical social worker and the Director of Educational and Social Services here at Alzheimer's Foundation of America. As you may know, November is Alzheimer's Disease Awareness Month. So to kick off the month, we here at AFA thought it would be fitting to provide an informational presentation about Alzheimer's disease and give you an opportunity for you all to ask any questions that you may have, share thoughts or stories. So I will go through this presentation, and I'm thinking around 10 minutes because the presentation should be about 20 minutes or so. I'll stop and check in with Kara, who's helping me today, to see if you have any questions or thoughts yet. This section should probably be after I talk about the progression of the disease. So as I'm talking, I'd recommend that if you have any questions or thoughts that come up for you, just go ahead and type them in so that when I get to the pausing point, your questions and thoughts will already be submitted. And just so you all know, Kara Rogers, who's helping me today, she is our senior licensed social worker who helps support callers on our toll-free helpline. Our toll-free helpline is actually worldwide because we do talk with people from all over the entire world. It's pretty amazing. So if I'm unable to answer any questions in the moment, I'll refer to Kara. And if we need to find out more information from you, I can go ahead and do that, and I'll email you the answer to your questions after the presentation. And at the end of the presentation, you will also have the opportunity to ask questions and share your thoughts. So I really do highly encourage you to share your questions and your thoughts because I want everyone to feel that this is a safe space. There is absolutely no room for judgment here. Kara, would you like to say hi to everybody?
Yep, hi everyone. So nice to be here today. I'll be here assisting Jennifer. And then just to let you know, the PDFs for the handouts are at the bottom, so you can access the handouts that Jennifer will be going over today.
Great, thank you.
And we'll be able to send those out if you're having any difficulty. Okay?
Yes. Okay, so I'm having a little bit of struggle with my, okay, here we go. So I'll be providing an overview of Alzheimer's disease, which will include symptoms and progression of the disease, as well as potential causes, risk factors, and what you can do to improve your overall health. And at the end, I will bring it all back to the person and highlight some thoughts that we all must remember to be helpful and supportive to those we love with Alzheimer's disease. So I'm going to first start to go off with a brief overview of dementia, because I think it is really important to clearly define what dementia is and what Alzheimer's disease is, since for some it can seem a bit confusing, but Alzheimer's disease is actually a type of dementia, as well as other types that I'm going to briefly review. So what is dementia? Dementia is not a disease itself. It's actually a term, an umbrella term, describing a range of symptoms. And impact can be seen in the following areas: memory, judgment, motor skills, communication, and mood. Dementia is caused by damage to brain cells. This damage interferes with the ability of brain cells to communicate with each other. So when brain cells cannot communicate normally, thinking, behavior, and feelings can be affected. And unfortunately, at this time, there is no treatment that's currently available to cure dementia or to alter its progressive course. Yet there are numerous treatments that are being investigated in various stages of clinical trials. Much, however, can be offered to support and improve the lives of people with dementia and their caregivers and families. The principal goals of dementia care include early diagnosis in order to promote early and optimal management, optimizing physical health, cognition, activity, and well-being, identifying and treating accompanying physical illnesses, detecting and treating challenging behavioral and psychological symptoms, and providing information and long-term support to caregivers. Dementia care plans must always be tailored to the individual and their family because how quickly dementia progresses varies greatly from person to person. So the types of dementia include Alzheimer's disease, which is the most common form of dementia, and what I will be mostly focusing on during this presentation, but I just wanted to first inform you of the other types of dementia. So there is vascular dementia, which is often related to strokes, whether one large stroke or multiple smaller strokes. Risk factors also include high blood pressure, diabetes, and irregular heartbeats. Then there's also frontotemporal dementia. This was formerly known as Pick's disease. It occurs when clumps of abnormal proteins form inside nerve cells. That causes them to die in the front or side portion of the brain. And then there's Lewy body dementia. Lewy bodies are tiny structures that develop inside brain cells and disrupting brain chemistry and leading to brain cell death. So Lewy body dementia is closely related to Parkinson's disease and is also more common in men. There's also Parkinson's dementia as well and AIDS dementia complex. In the early days of HIV/AIDS, about 40 to 60% of individuals living with AIDS would experience some type of AIDS dementia complex, but since medications have come up to have been available to be able to work with these symptoms, the ADC has greatly decreased. So the impact of Alzheimer's disease and other related dementia illnesses can be extensive. These illnesses will affect a person's ability to communicate, care for themselves, relate to the external world, as well as affecting relationships with family, friends, and their community. Dementia is overwhelming for families of affected people and for their caregivers. Physical, emotional, and economic pressures can cause great stress to families and caregivers. And support is required from the health, social, and financial and legal systems as well. And people with dementia are frequently denied basic rights and freedoms available to others. In many countries, physical and chemical restraints are used extensively in care facilities for elderly people and also acute care settings. Even when regulations are in place to uphold the rights of people to freedom and choice, this still occurs. And an appropriate supportive and legislative environment based on internationally accepted human rights and standards is required to ensure the highest quality of service provisions to people with dementia and their caregivers. So to get into a little bit deeper with Alzheimer's disease, which I mentioned that I'm going to be focusing on more than anything, is that Alzheimer's disease is a brain disorder that impacts memory, thinking, and language skills, and the ability to carry out the simplest of tasks. It is the most common form of dementia, as I mentioned. It is chronic, progressive, and a degenerative disorder. And there are two types of Alzheimer's. There's young onset and late onset. So young onset of Alzheimer's is actually pretty uncommon. Only about 5 to 6% of people with Alzheimer's develop symptoms before the age of 65. But those who do develop the symptoms before the age of 65, their symptoms, they start to experience symptoms as early as their 40s and their 50s. And in 2013, an estimated 5 million Americans aged 65 or older had Alzheimer's disease. This number may actually triple to as high as 13.8 million people by I think it's 2050, and this is according to the CDC. And it is considered the 6th leading cause of death in the United States. When we talk about people who pass from Alzheimer's disease, usually what happens is they end up dying from the complications of Alzheimer's disease. So from infections or from blood clots, or also just simply from the decline of brain function, because people, get to a point where they're unable to feed themselves or swallow. So there are many complications that come into play that end up being the reason for the person's passing. And memory loss is often the first presenting symptom. So memory loss. There are a variety of reasons why memory loss occurs. And it's important to note that memory loss is not a normal part of aging. As we age, memory can be impaired here and there, misplacing keys, forgetting a name, not remembering an activity. And there are health-related conditions that can cause memory impairment, which can often be easily treated with medical interventions. Health conditions that mimic dementia-related illnesses include B12 deficiency, hypothyroidism, chronic alcohol or drug misuse, brain tumors, delirium. But if the memory loss disrupts daily life through the slow decline of reasoning, thinking, and memory, these could be symptoms of Alzheimer's disease. An individual could present with one or more signs and symptoms in varying degrees. So it's extremely important to consult a physician if you notice any of the following: memory loss around confusion, around time, place, or person. Familiar routines become a challenge, such as chores and work-related activities, or executive functioning skills like money management and problem solving. One of the handouts that I did provide for you is titled Dementia's Warning Signs. This is a really great reference that provides an overview and examples of all those potential signs. And then there are the symptoms of Alzheimer's disease that affects one's ability to communicate. For example, amnesia, which is the inability to retain or recall memories, including facts, information, and experiences. Aphasia, which is the inability to produce or understand language. Apraxia, which is the inability to coordinate or execute purposeful muscle movement. Agnosia, which is the inability to use or recognize information from the five senses, or confusion with the five senses. And then there are psychiatric symptoms such as personality changes, depression, and psychotic symptoms. And the other handout that you have there, it's titled Cognitive and Psychiatric Symptoms of Alzheimer's. That explains such symptoms a bit more extensively. So I would highly recommend that you take a look at that handout as well. Okay, so each stage of the disease continues to impact one's ability to communicate to the point of only being able to communicate through touch and connectedness. In the early stages, there's problems with complex mental tasks, confusion or disorientation in familiar places, difficulty learning new tasks or remembering new people, mild language challenges. And then in the middle stage, there's disturbances in sleep-wake cycle, hallucinations and delusions, difficulty executing personal care independently. And then in the late stage, there's severe language and motor impairment. This requires complete assistance with personal care. And there's also widespread disconnect from the environment, people, and also oneself. I'm going to stop here just for a second, just to check in with Kara to see if anybody has any questions yet.
Yeah, so we do have some questions that are coming in. So one of the questions is, could you address the relationship between sleep and dementia? Does sleeplessness cause dementia or Alzheimer's, or is sleeplessness an early symptom?
Sleeplessness is definitely, I would say, more of a symptom. And unfortunately, no, I don't know if if you've ever heard of sundowning, sundown syndrome. So this is something that can occur for people when they're having troubles with sleeping, because we have other trainings, and we'll probably actually have another one of these types of presentations to talk about wandering, that can also kind of include sundown syndrome as well. So it's when people are trying to meet that unmet need. And so if someone isn't getting good rest, that can definitely be a trigger and bring something like that on. So sleeplessness can absolutely complicate the overall symptoms of the disease.
Mm-hmm.
Is there anything you'd like to add to that, Kara?
Yeah, and I would also just say that, if you're noticing a difference in the person's sleep pattern, that's where
Mhm.
it's important to take note of, if you're seeing changes where it wouldn't be uncommon if, let's say, someone worked the night shift and they were up all night. I'd be like, oh, okay, they're just in their normal routine if that was what they used to do. If this was someone who would never stay up at the night, but now they can't seem to sleep for like 5 days in a row, then I'd be like, okay, this seems like a concern in the behavior. So let's check in to see what's going on.
Yeah, absolutely. Because sleep is it's such an important part of our health, and I'll get into that a little bit when it comes to what we can do to reduce, the likelihood of Alzheimer's disease. And sleep is a big one, so it's definitely something that you want to address as soon
Mm-hmm.
as you see a problem in that.
Mm-hmm. We have someone else who's asked, what's the correlation between a person's medications and dementia and Alzheimer's?
Yeah, that's because there are all different types of medications that are coming out right now too. There are medications for cognitive symptoms, and then there are also medications out there that people use for psychiatric symptoms. And it's something that seriously needs to be monitored, because especially for new medications and the medications that have been out there, sometimes the symptoms that you see could simply be a reaction from medication.
Mm-hmm.
And if that's the case, that means that symptom could be addressed and possibly eliminated if the medication is changed, or the dosage is changed. So it's something that definitely needs to be monitored very closely. Oh
Yeah.
no, the light turned off.
Oh, it might just be motion censored. And while Jennifer's dealing with that, I'd also say with the medication, just management's important, because if your person's going to many different doctors and they're not on the same page about what medication that the person's taking, or that person doesn't remember and doesn't share that information, then that could exacerbate some of the symptoms or confusion or disorientation. So that's why it's important, prior to diagnosing, to check in about the medication and how it's impacting the person in general, to see if there's something underlining that is causing this not so normal memory confusion.
Yeah, it's absolutely. Yeah, we've talked before about coming up with some sort of like a binder of sorts that people can use for medical and any other important information that people can take with them to their different appointments. Because when you get to this point of having Alzheimer's disease, a lot of times you have a lot of doctors involved and a lot of appointments involved. So it's good to have that, to ensure that communication between all providers is happening.
Mm-hmm. We have someone else who just asked a question, and they said, dementia seems to run in some families. I have a friend whose mother and sister had it. So what category does that fall into?
Well, so I'm actually going to be getting into the risk factors, and that family history can be a risk factor. It's not the risk factor, but it can be, and it can increase if there's more than one person in your family who has Alzheimer's disease.
Mm-hmm.
So I think in that point, it's just good to know, just to be informed with that information, so that you can try to make steps to maintain that healthy lifestyle, so that you yourself have the overall health that's important.
Yeah, and then I have someone else. I'm going to group these two questions together. One being, is there links between Lyme disease and dementia, along with, how does bipolar react with Alzheimer's in terms of that, if it increases chances or so?
That's a really good question. So when it comes to Lyme's disease, I'm honestly not sure about that. I know that there is some information out there that I have heard, but I think I would prefer to be able to gather a bit more information before answering. I'm never one to make something up in the moment. So, but I know that that it can. I mean, it is a chronic illness that you end up getting a chronic disease. So it would make sense if that did affect, dementia. If you had a dementia-related illness, that it would affect that.
Mhm.
And then with bipolar, it's that's a more of a mental illness, and Alzheimer's disease is actually not a mental illness. It's a disease. So, but there are times when people will look at certain medications that are used for bipolar that they will actually prescribe to a person who has Alzheimer's disease, but it's not FDA approved. And that's what's so important to understand when it comes to any kind of psychiatric medications, that they're not FDA approved, because there are serious, serious side effects to that.
Mhm.
Um, but is there anything that you want to add to either of those, Kara?
Yeah, and I would say also, we know there's gonna, like, Jennifer's gonna get into the risk factors. However, we know that, right, overall health is gonna have an impact on our chances of getting this disease. So, the more we have, it increases our chances. And so it's something that could definitely, affect it. But again, that's based on chance, because you see people who have gone through similar experiences or illness and haven't gotten Alzheimer's or disease. So that's
Mhm.
where this kind of comes into play, with needing more research to figure out, the direct connections, and even if there is or not. But there's so many factors going on into it that it's really hard to just specifically say, okay, you have this disease and that means you're automatically getting Alzheimer's. So we
Right.
know that if someone, for example, drinks very heavily throughout their life, that does increase their chances for getting Alzheimer's. So it's something along the lines of that, I would say, and phrase it as.
Yeah, definitely. Okay, so for time's sake, I'm going to keep moving on. But as I said at the end of the presentation, you will all have another opportunity to be able to ask any questions or share any thoughts. So thank you, everyone. Those are really, really good ones. Okay, so I'm going to be now getting to the risk factors. I'm just trying to move this so it can get out of my way. So, as it says on here, the causes and risk factors for Alzheimer's disease, there is no single cure, or sorry, no single cause of Alzheimer's disease. Most individuals do develop the disease after the age of 65, as I mentioned. And after 65, the risk actually doubles every 5 years. And then I also read somewhere too that after the age of 85, the risk reaches nearly 1/3 of the population. So 1/3 of those 85 and older will develop Alzheimer's disease. And as the one person had asked with family history can increase the risk of Alzheimer's disease, especially when one close relative, more than one close relative, has the disease. But what's interesting, though, is that less than 1% of Alzheimer's cases are caused by deterministic genes. And just in case if anybody doesn't know what that is, deterministic genes actually cause disease. So those genes, they guarantee that a person is going to develop a certain disorder or disease. And then other types of risk factors include head injury, especially multiple head injuries, and heart conditions. That would include heart disease, diabetes, stroke, high blood pressure, and also high cholesterol as well. Okay, and then coming to stress, the brain and Alzheimer's. There's more and more studies coming out looking at stress as well as trauma and how that affects the brain. So researchers in a study at the University of Wisconsin in 2017 They found that every stressful event was equal to 1.5 years of brain aging across all participants, except for African Americans where every stressful event was equal to 4 years of brain aging. So the study also found that African Americans reported 60% more stressful events on average than Caucasians, which may help to explain why there is a higher incidence of Alzheimer's disease, because African Americans are 2 times more likely to develop Alzheimer's disease, and Latinx Hispanics are 1.5 times more likely. So for Black, Indigenous, and people of color, race-based traumatic stress is connected to healthcare disparities, environmental causes, and daily experiences of racism. So this is an extremely important topic that deserves much more time than what I'm able to give today. So I do highly encourage you all to check out our upcoming trainings in the new year that's going to include further exploration of race-based traumatic stress and overall trauma as well, and how it all affects the brain and can increase the likelihood of Alzheimer's disease. So, you know, although we are frequently unable to control the amount of stress and stressful events that occur in our lives, we can control or try to control how we eat and take care of our bodies as well. So one promising line of research suggests that strategies for overall healthy aging may help keep the brain healthy and may even reduce the risk of developing Alzheimer's disease and other dementias. So these measures include eating a varied and nutritious and low glycemic diet that includes foods that contain vitamins D, C, E, and also omega-3 fats, getting regular exercise and maintaining a healthy weight, reducing stress as best you possibly can, keeping your mind active. While the debate continues over whether cognitive exercises will help lower the risk of Alzheimer's disease, keeping your mind nimble will enhance your overall well-being. And keeping your blood pressure and cholesterol at normal levels, that's absolutely really important. Keeping an active social life and strive to widen your social network. Maintaining regular checkups with healthcare practitioners. Don't smoke cigarettes, that's really, really bad. And you want to get enough good quality sleep, as we were talking before. And you really want to see, like, for your age group, what that amount of sleep is, because it's actually different for each age group. And then you want to keep yourself informed. You want to learn about recent advances in research on preventive activities and treatments for your condition. You know, and that's what's so important, is that there's ongoing research going on, there's ongoing information out there. So keeping yourself up to date with all of that can really help. It can really help to know what it is that you can do to incorporate in your daily life. So before I end, I would like to come back to the person who is living with the disease and those who are supporting. Because not only do we want to be focusing on people with Alzheimer's disease, but also the caregivers as well and the family members as well. So, you know, feeling safe and secure, it is imperative to assist an individual living with dementia in feeling safe and secure, because the very nature of the illness can lead to feelings of disorientation, fear, insecurity, and uncertainty. So here are some questions that I would like to hear from answers from you all. So I'm gonna read the questions, and then it would be really great if you would type in some of your answers so that at the end we can review what people were saying, what people were thinking. So what would you want from people who are caring for you? What would you not want from them? What would you want them to know most about you? And what would be most important? You know, and these questions, it always makes me think about why it's so important for early diagnosis. And I'm going to get into that in a second. But not only about diagnosing the disease, but also empowering the individual to prepare for what's coming ahead by having those conversations with their loved ones on how they want to be treated and what's important to them before they're unable to do that. So, knowing each person within their unique context, that's what's so important, because every person is an individual. Every person has a different issue going on in their life. Every person has different strengths and deficiencies going on. So we want to be able to really focus on the individual when we are supporting them. The person is more than their diagnosis, and we always want to be able to help separate the disease from the person. If someone's having a bad day, it's the disease that's causing that bad day. And we want to focus on strengths, rather than dwelling on deficiencies. The longer that we can help to maintain someone's independence, we're also maintaining their dignity while respecting the fact that our loved one is still very much an accomplished adult. And so early detection, as I said, it's so important. So if you're at a certain age or have concerns about your memory, you can always get a memory screening. AFA actually offers free virtual memory screenings every Monday, Wednesday, and Friday nationwide. So you can just call our main number or check out our website for more information on that. And if you are concerned about someone else, it's always best to first obtain as much information, educational information as you can, and also figure out if you want some support when you're talking to the individual about first steps. And early diagnosis is so important to be able to make plans for care and how to talk with friends and family, because the individual diagnosed must always be included in planning and discussions as long as they are able. Now, we always must remember too, in creating positive change for adults, for individuals, we serve that family, as well as the family members and the people that we support. We must also address challenges and concerns on a meso level and a macro level. So as stated in the beginning of this presentation, dementia is a public health priority, which includes socioeconomic impacts and human rights. So there are actions that can be taken, such as promoting a dementia-friendly society, making sure you remain educated, help reduce the stigma of dementia, invest in health and social systems to improve care and services, advocate for increased research on dementia, and most importantly, advocating for everyone in this country to have access to affordable and high quality healthcare. Okay, so we've gotten to the point where we are just about at the end of our presentation. I will be sharing AFA's resources as well, but I first want to just check in and see if anybody has any questions or thoughts that they want to share.
Yeah, so we definitely have some thoughts and questions coming in. So I'll start with the people who responded to the question. Some people said they would want patience, humor. They would want the person to be educated about dementia and the disease. They wouldn't want their family to laugh at them for the things they say or do, but to show them. Somebody else said that they would like lots of music, colors, flowers, and hopefully dogs.
Yeah.
And we have someone else saying that, in a previous situation they wish that they would have been able to explain everything ahead of time. That way their person would have known what would be going on and know that they would also be okay. And they would be okay with it. But this way, she would be able to be aware of what was going on from the beginning.
Yeah. Yeah.
We also have someone who said, no baby talk, it makes them crazy. So doesn't appreciate it. So I agree with that.
It's like we were talking, and this is where I got the term from you, Kara, an accomplished adult. Just because the person is experiencing Alzheimer's disease, they're still an adult. Just because they may need additional assistance, they are still an adult. So always be talking to someone as an adult.
So we do have someone who brought up that they would also like to have constant visits, whether it be from family, so that she knows there with her, as well as someone would want music because that's what brought her grandfather joy. So she thinks that it would bring her joy. Just important to have those memories and feelings.
Yeah, those are beautiful.
Yeah. And then I would say in terms of questions, we have some going on, some about specifically about, unfortunately, how come dementia, it looks differently in so many people. Some people turned out maybe their moods are a little bit more happy or content, while others might be upset, or agitated at times.
Yeah. Yeah, and that can, I mean, I think a lot of that well, for one, I mean, this disease, it affects everyone differently. But then it also depends on what stage you're in too, because Alzheimer's disease does affect a person's personality, and someone who may have been extremely positive, upbeat, happy person, the disease then causes them to their personality to change, and all of a sudden they become a very negative person. So it definitely depends, and it's unfortunate. But that's why, I think anytime that an individual is experiencing some clarity, to have those conversations to help figure out what can I do in those moments to help you, to support you when you're showing, this type of attitude or behavior.
Yeah, definitely. And then we had a few questions. I'm going to group them together. But one, it's, asking about, especially during COVID time, how important is it to get a diagnosis, as well as what type of doctor should someone be seeing if they think there is a diagnosis or suspect something's wrong?
Mm-hmm. Yeah, so it is there. You always want to start with your PCP, if you have concerns about symptoms, who can then help refer you to the right specialist after that, gerontologist, and then you also may need to go to a neurologist as well, because we always want to be ruling out other physical issues that might be going on, because as we said, there might be some sort of deficiency of sorts that your brain or your body is experiencing, that might answer those. So that's why you always want to go to a healthcare practitioner right away, to be able to rule anything out first. But yeah, early diagnosis is extremely important, because that's when you can sometimes slow the progression. And like when it comes to these new cognitive medications that they have out there, they only work temporarily, but if used early on, they can be somewhat effective in slowing the cognitive decline.
Yeah,
And then, as I mentioned too, just making sure that the individual has the time to be able to talk with their friends, talk with their family about how they want to be treated as the disease progresses and what kind of care they want. When they may want to go to a long-term care facility, what they want that to look like. So another really important reason why early diagnosis is so important.
And I just add to that, sometimes depending on the state you're in, a diagnosis is needed legally if you're going to be power of attorney of someone, guardianship, conservatorship, all that needing to be discussed with an elder law attorney, but having the diagnosis sometimes is needed in order to do other steps in the person's care plan.
Right. Yes, absolutely.
We do have someone who mentioned, how can we improve the quality of life for people who have this disease during COVID times, as well as to keep them active in general?
That's, I think I would say, I know Kara gets a lot of questions like that on our helpline, and the manager of our community classes, Jackie Gatto, she did a really incredible job at taking all of our community classes that we had here in person and turning them all into virtual community classes that you can find on our Facebook page. And those are all very therapeutic programs. So we've got music therapists, creative arts therapists, dance movement therapists, and then also artists and educators. So all of those programs are really great, and they're really geared towards helping to stimulate the mind and the body, so that people don't get bored, because we definitely have seen that if people aren't continuing to be mentally and physically stimulated, there can be a decline. So and that's hard. So I would say that especially when it comes to people needing to stay indoors, trying to figure out as many activities that you can do inside as possible. And sometimes it's just engaging your loved one in the daily tasks that you do. Just folding laundry or making the bed, anything to be able to engage them is really important.
And then we have someone, has asked about in terms of, stages, how many stages are there in the disease? And at what point do you establish that there's a change between stages or a person's moved to a different stage?
So there's the early stage, middle stage, and late stage. And as I had gone before, I wonder if I can go back just so that you all can see as I'm going through it. So this is the progression of the different stages. So as you'll see, like there are the mild language challenges, difficulty learning new tasks. That's when you're really going to start to notice the issues with memory, not being able to remember people, places, things. And then when the middle stage comes on, that is, as you can see on here, a lot of times people do start to experience hallucinations and delusions. We have some trainings coming up about trauma and people who may have been able to use defense mechanisms, coping mechanisms to manage difficult memories that they used to have. All of a sudden, they're not going to be able to do that anymore. And so some of those hallucinations and delusions may be incorporated in what they experienced in their past. So there's less of an ability to be able to manage their symptoms as there was in the early stage. And then in the late stage, that's where severe language and motor skill, motor impairment, and this is where touch and connectedness is so important. So somebody who may be starting to get really upset just by rubbing their back, that may help them calm down, because the disconnect, as it says on here, disconnect from environment, people, and oneself. That happens a lot more often, so that touch and connectedness is what kind of can bring the person back to being able to ease down. Is there anything you want to add, Kara, to that part? Or is that?
No, yeah, and I would also say, in terms of, stages and progression, we're not going to be able to provide a timeline, and say, okay, in this year, this month, this is when we're going to see a progression. And it's going to be very hard to find someone who's going to tell you, okay, this is the timeline. And so that's why it is important to meet with, a neurologist or your primary, so that way they have a baseline. So that way, if you think that there is a progression, then they're able to compare to how your person, has done previously. As well as the fact we do follow the National Institute of Health. So, we follow the 3 stages in terms of regards. I know other organizations may have it more broken down, but this is how we go about it. And so you can also find information about, the disease on there in terms of clinical trials that are going on currently, especially because I know a few people are asking about what are the chances for a cure. So you can find the most updated information on those trials.
Yeah. Yeah, and usually I would just to add the middle stage tends to be the longest stage, but we don't know what that means exactly for each person. And the late stage could last months to years. It depends on what the complications are that are associated with having the disease for that individual. Because as I said, it's more about the complications that can be the ending for an individual because of just everything that ends up happening to the person's brain and bodily functions.
Mm-hmm. Exactly. We do have someone who's asked, is it better to have a primary care doctor or a geriatric doctor? Which that can be both.
Right, right.
Mhm.
Yeah, because sometimes that's the person that you're going, depending on your age, and
Mhm.
some people want to hold on to the doctor they've had since they were a child, but they're not allowed to go to a pediatrician anymore. So
Exactly.
because if you have trust in a doctor, everybody wants to hold on to that doctor.
Mhm.
But if you're starting to see go into geriatrics, then you do probably want to have that as your primary care physician as well.
So we have two people, they just wanted to know when we send out the handouts, which we'll be emailing to all of you, if we could include the link about the UW race-based article as well from the
Sure,
Wisconsin.
sure.
And then another question that we received is, when a person is agitated and is experiencing delusions, how do you respond? Do you go along with them or do you tell them the truth?
See, when it comes to somebody experiencing delusions, you never want to fight those delusions because if someone is believing in a certain thing, you don't want to argue with them because that's just going to make them more upset. Because in that moment, this is their reality. So you do want to just go along with them through their delusion, and when able, redirect them to something else, an activity that they might enjoy. Anything to be able to help get their mind off of the delusion that they're experiencing. And you also wanted to look around and see if you can figure out what might have triggered the person. If there's an unmet need they are able to meet immediately. All of those are really important to consider. The light went off.
It's just that movement. See the lack of movement.
Yeah. Um, but yeah, so if someone's agitated and experiencing delusion, just be supportive, be patient. See if you can figure out what the trigger was. See if you can figure out if there's an unmet need that you can meet in that moment. And then also just, help them through the delusion and see if there's some way that you're able to redirect them to something else.
Mhm.
But I would say for time's sake, we may need to wrap this up. I also want to say too that the email. So I am going to go over our resources as well with AFA, and then at the end there is my email address that people are able to email me. So if there's anything additional that you want to be learning about, or you think that would be great for us to present on when it comes to Alzheimer's disease, shoot me an email. Let me know because this is kind of just the start. And this is just like a basic overview of Alzheimer's disease.
Mhm.
But we certainly do have professional trainings going on and doing these short presentations for everyone. We're definitely open to doing. So if there's any topics that you all would like to learn about, let me know. But yeah, so for our resources and support, we have AFA's national toll-free helpline. I did say worldwide because people from other countries do call us all the time. The toll-free helpline is open 7 days a week, Monday through Friday, 9 a.m. to 9 p.m., and Saturday and Sunday, 9 a.m. to 5 p.m. We also have our virtual community classes, as I mentioned, that you can find through our Facebook page. We have Dementia Care Professionals of America. That includes our Partners in Care training, as well as other trainings as well, where we're able to provide continuing education credits to licensed social workers. So definitely check out those. We've got some new ones coming up at the start of the year. We have AFA's Educating America Tour. It looks like the next stop is November 10th in Utah. We're doing all of these virtually right now because of COVID. We would certainly hope to someday be able to have the tour in person again, but for right now, you can check it out via webinar. And for November 10th, our special guest speaker is Dr. Oz. And then discussions are going to be about proactive, family-engaged dementia care, living at home with dementia, and also loneliness and social isolation in the older adult population. So check out all of those webinars. We have our national memory screening program, as I mentioned. That people are doing those now virtually. So you can call our main number, 866-232-8484, or go to our website to find out more information about those. We also have our Excellence in Care Dementia Care Program of Distinction. Right now it's on hold because we're unable to do visits because of COVID, but we hope to get that started again next year. We have our Care Connection monthly webinar, and those are really great. Cara is actually the producer of our Care Connection monthly series. What is the next topic, Cara?
Next week is going to be medications and memory. So many of you who had questions kind of about that, we're going to have Dr. Judith Beisner. She works at the pharmaceutical school on St. Joseph's in New York, and she will be going over how medications can impact memory, why medication brown bags are helpful, to go over that overview. So any questions or interest in that, definitely sign up on our website.
Yeah, those are excellent. We also have support groups as well that right now those are all via telephone. I will say that I think they're all filled at the moment, but you can always call and give your name so we can put you on the waiting list. And those support groups they're general caregiver support groups. We've had support groups for people whose loved ones are in long-term care facilities and unable to see them because of COVID. Also managing family dynamics, everything that goes along with that. So they're all really excellent support groups. We also have Alzheimer's Today magazine as well. So if you want to be on the mailing list, just shoot us an email. And then just AFA unites 2,700 plus member organizations nationwide that provide direct resources and care. So we are all over the place and have so much support from everybody nationwide. So it's excellent. Yeah, so that's my email address, jreader@alzfdn.org. If anybody has any other questions or thoughts they want to share, just shoot me an email. And we hope to have you all join us again when we do another one of these presentations, hopefully within the next month, I'm hoping. So yeah, thank you all very much.
All right,
anything from you, Cara? I didn't know if I forgot anything.
No, everything's good. And again, if there's any questions, get in touch with Jennifer. For some of you, if you had personal situations coming up where you wanted some advice on, definitely call our helpline. We're more than welcome to discuss that stuff with you.
Yes, that's what the helpline is there for. Absolutely. All right. Well, thank you everyone so much for joining us today.